many questions on how long vaccine-induced immunity lasts, and the reason I ask this question again is because there's a big debate on when boosters need to be given to those who were vaccinated in the first phase, because we vaccinated our most vulnerable population, our frontline healthcare workers in the first phase. Do people who were vaccinated in the first phase still have vaccine-induced immunity? What more can you tell us about a timeline for boosters?
So this is an important question for which I don't have a definite answer, because we need to really find what should be the timeline. We can't look at antibody level and then decide. It will have to be time-based, that if you've had a vaccine, say 1 year ago, then you should take your booster. But we need to have more data on that. Now, if you look at what's happening in the UK, we are seeing a surge of cases in the UK, but we are not seeing an increase in hospital admissions or deaths in UK because of COVID. Now, UK started its vaccination in December. So if we are not seeing that, that means the vaccination that were given in UK in December seem to be holding out till now, because it's still not there. We are still not seeing more hospitalization or deaths, and the vaccine is still protecting people against hospitalization and death. So if we keep that in mind, then in my mind, we are still in the safety zone as far as hospitalization and deaths is concerned from the virus right now. But like I said, if the virus mutates and it decreases our immunity level, then we will have to look at a booster earlier than later.
Right. Sooner rather than later, boosters are going to be given, because that's what's happening globally. But do we have any kind of rough time estimate on whether it will happen, at the 1 year mark, or, do we have any clarity on what India's plan of action is going to be when it comes to giving boosters, especially to the vulnerable?
So I don't think there is a clear-cut, there are a lot of discussions going on, but I can't say that we have a clear-cut decision. But I think that it would be sometime next year that one would look at boosters, because that will be the 1 year mark. And it will be likely that one would focus on the more vulnerable population to begin with, those with comorbidities and the elderly to start with, because those are the ones who could have more severe disease.